Okay, so this is going to be my week 4 health assessment video. To start, I would just knock on my patient's door and provide privacy behind me, do my hand hygiene. I would acknowledge my patient, introduce myself, explain what I'm going to do and how long it's going to take, make sure that it's, okay with them that I do the assessment, and then thank them for the assessment. Then I would identify my patient, so I would have them state their name and their birthday, and I would just check it with their armband. Assess for any pain, and then assess for any allergies. So starting with the eyes, I would administer like a Snellen chart just to check for like 20/20 vision. Next, just like looking at the eyelids, just by inspection, I should see that they are symmetrical. I would just kind of palpate and just make sure that there's no tenderness, look for any edema. I want to make sure that the hair is normally distributed on the eyebrows and then in the eyelashes. Their sclera should be white, and then their conjunctiva and their puncta should be pink and moist. So I will just kind of pull down and just make sure that that's pink and moist. Their cornea should be intact. And then taking my pen light, I just want to make sure that my pupils are Perla. So I want to note the size to begin with. So usually with a pupil, you have like a pupil gauge on your pen light, so you can use that if you need to. And then normally when I assess anyone's pupils, I just have them look at my nose, and then I will just shine the light in. Obviously I can't do it on myself. But the pupils should be equal, they should be round, reactive to light, and they should accommodate. And then noting the size. So after that, I just want to make sure that there's no drainage or any lesions on the eyes. So next I would assess for the corneal light reflex. So what I would do is I would stand about 2 feet away from the patient, and I would have them focus on a stationary object, and I would shine my pen light to where it's right in the middle, as I'm 2 feet away, shine right in the middle. And what you should see is if the pupils, if the gaze is symmetrical, you should see 2 little pinpoint, you should see the light in both pupils, and they should be even. So if their gaze is not even, then it won't be symmetrical. After that, I want to use the wagon wheel test and just assess for the 6 cardinal fields of gaze. So I would just have them follow my finger, the 6 gazes. And then I just want to assess for any like extraocular movements. So I want to make sure that there's no nystagmus, so when their eyes move really quickly, strabismus when their eyes are crossed, and then any ptosis, so any drooping of the eyelids. After, that should be it on the eyes. So after the eyes are done, then I'm going to move on to the ear. So I'm going to look and make sure that the auricle and the pinna are aligned with the outer canthus of the eye. So then I would take my otoscope, and then I would look into my ear. I would notice like a little bit, like a small amount of like golden cerumen, which is normal. So that's, you're looking at the earwax. Then I would look at the tympanic membrane. So it should be translucent. It should be like a pearl kind of gray color. And then I would do that on both sides. And then after that, I would just palpate the tragus and just make sure that there's no pain or no tenderness. Check for any lesions or any drainage. And then just note any ear piercings on the ears. Next, I would perform the Weber and the Rhine test. So I would have my tuning fork, and I would strike my tuning fork, and I would put it on top of my head. Well, I guess on top of the patient's head. And so that would be the Weber test, and that just makes sure that the hearing is symmetrical on both. So your patient should hear that tuning fork in both ears, and it should be even. Next is the Rhine test. So I would also strike my tuning fork, and then I would put it right here on the mastoid bone. And usually it takes a little longer, so you should hear it in the other ear before you hear it in this ear. Moving on, I would just kind of inspect the nose. So I want to make sure that it's symmetrical. I would have them, so I want to make sure that their nares are patent. So I would have them close one nair, blow out, close the other nair, all that good stuff. I want to make sure that their septum is intact. Just note any lesions or any drainage. Palpate it, make sure it's not tender, all that kind of stuff. Make sure that there's no deformities. After the nose, you're going to do the sinuses. So you're just going to kind of palpate the frontal sinus and then the maxillary sinus. Note that there should not be any tenderness unless, you know, they have, sometimes if you have like a sinus infection, they could be tender. And then you're going to take your pen light and you're going to do the transillumination test. So you're just kind of going to shine your light and you're just going to put it on the, where the sinus is, and you should see this little red halo around your pen light. And then that's the sign you're looking for. Moving on from the sinuses, you want to look at the lips and the tongue and the mouth. So gonna have them stick out their tongue and just make sure that it's symmetrical. Their lips, tongue, and then their mucous membranes, they should all be pink, moist, and intact. They should not have any lesions. I always just check and make sure that there's no like yeast in there, any white patches. You want to look at the tonsils. I would then have them stick out their tongue. Their uvula should be midline, and then I would then stick a tongue depressor in and just make sure that their gag reflex is present. And I just want to note any lesions in there, any deformities, any variations with their tongue, note the color. And then after that, I would just reassess my patient for pain, ask if they, you know, if I can get them anything like a blanket or like a soda, offer them, make sure that they don't need anything else, and then thank them for letting me do my assessment. I would do my hand hygiene, and then I would also reassess pain before I did my hand hygiene.